Hello and welcome to today's speed seminar. Today we're talking about apportionment. My name is Dr. John Alchemy with RateFast. Let's first define apportionment. What is it? Apportionment is this process of determining resultant work permanent disability from unrelated conditions. So for example, perhaps you had a pre-existing back injury that was caused by gardening, and it resulted in a permanent disability, and now you have a work injury on top of that. Well, when that work injury becomes MMI, in California, the employer only pays for permanent disability caused by work. So the process of sorting out permanent disability from pre-existing conditions or illnesses from a work-related permanent disability is the activity we call apportionment. Now, apportionment can actually be done using a variety of methods. The most classic is subtraction, meaning that you have a pre-established baseline of a condition, and then a second condition is overlaid on the first. Then you figure out what the final resultant permanent disability is, and you subtract the baseline permanent disability. If it sounds a little confusing, it is. But let's think about it like this. I have a pre-existing back injury. I can lift 50 pounds. I'm hurt at work. I receive treatment. I arrive at MMI. I can now lift only 25 pounds. Using the subtraction method, my apportionment is 50% to the pre-existing condition and 50% to the work condition. Other approaches can also be used, such as medication usage. Perhaps before I used 2 Tylenols a day, and now I'm using 4 Tylenols a day. But that's necessary to remain at the same level of permanent disability I was before I got hurt on the job. Again, using an approach like this, we would say 50% to the pre-existing condition and 50% to the new work-related condition. As long as the medical provider is using some measurable data that is directly related to or a measurement of the permanent disability, this can be defensible and used in the report as a basis for opinion. Again, please remember that apportionment is always expressed in percentages. And now, how about a little bit of nerd knowledge? This is part of the speed seminar where we talk about some technical aspects of the topic. So, some nerd knowledge about apportionment. Impairment is not apportioned. Only permanent disability is apportioned. You might recall from previous speed seminars that impairment and permanent disability are two very separate, exclusive, and independent concepts. Well, unfortunately, when we created the California Permanent Disability Rating, we didn't have a firm grasp or understanding of the definitions as they're called out in the AMA guides. As a result, a California Permanent Disability Rating incorporates a whole person impairment rating regardless if that whole person impairment rating actually results in any permanent disability. Now, from an administrative standpoint, if the carrier sees any type of permanent disability rating, they may want apportionment, even if there's no permanent disability from a functional standpoint that affects the patient. Okay, for our case study, I'm going to throw you a softball, and actually we already went through this scenario, but here it is again. Let's see if you were listening. A 36-year-old female has a prior lumbar condition, and she had resultant permanent disability, couldn't lift more than 50 pounds. She gets hurt at work, receives treatment. Now at maximum medical improvement, she can only lift 25 pounds. Question: what is her apportionment? Answer: that's right. 50% is apportioned to her pre-existing non-industrial condition, and 50% is apportioned to the work injury. That's it for today's speed seminar. Thanks for joining us on apportionment. If you'd like to learn more, please come over to our blog at www.rate-fast.com and click on the blog tab.